Support for this show, Politics Done Right, comes from politicsdoneright.com, publishers of How to Make America Utopia, Take Away the Economy from Those Who Rigged It, As I See It, Class Warfare, The Only Resort to Right-Wing Doom, It's Worth It, How to Talk to Your Right-Wing Relatives, Friends, and Neighbors, and other books written by Egberto Willies. Welcome to another edition of Politics Done Right. I'm Egberto Willies, your host. Today, I'm honored to speak to a special person. I'm going to tell you guys why I wanted to speak to him. But first, let's introduce him. Dr. Eric Lulub is the Chief Medical Officer of the West Boca Center for Wound Healing in Coconut Creek, Florida. Dr. Lulub is a board-certified podiatric surgeon and a national expert in health policy, coding, reimbursement, and practice management. Dr. Lulub, how you doing? And welcome to Politics Done Right.
Oh, thank you. I'm so excited to be here. And thank you so much for extending the invitation for us to talk. I know we have a lot to talk about. I know there's a lot burning between your ears about everything that's been going on with the ACA. And
oh, yes,
it's a mess.
I mean, I've been there from its inception, and I've gone against myself so many times because when they were starting about talking about the ACA, the one thing that I didn't like it, first of all, but then I said, once we got a public option, I'll be happy because, what happens is if there's a public option, eventually it will have to, it will turn itself into a Medicare for all type system. But they were smart as well. They realized that and they made sure that that was not placed in it. But let's get busy first of all. I want to start like this. I read a story that you wrote about a man who came into your office. And I am not a super sentimental kind of a guy, but I had to kind of put my head back, not to have the tear fall out.
No.
Because let me tell you that doctors, my sister's a doctor. I have other relatives that are doctors. In fact, she's at a medical school. She's one of the deans out there. And one of the things that we know from her, my daughter was in med school, is that there are not a lot of doctors that are not there just for the money these days. And sadly, I think I don't put that on them. I blame that on us because of the healthcare system that we created. Go ahead. You want to answer that? Go ahead.
Well, because, you brought up such a convoluted point that, to really understand healthcare in America today, you have to dial it back to 1973 when every insurance company in the United States was actually a nonprofit.
Mm-hmm.
And when the Reagan administration did their deregulation of just about everything about U.S. society with, breaking up AT&T and breaking up the Bells and then the insurance industry, the banking industry, and this massive amount of deregulation in the early 80s, which led to our first recession, by the way, if you don't recall.
No, I sure do.
Okay.
Yeah.
And then what happened was the insurance companies figure out the game plan, which was to wedge themselves between the doctor and the patient. And they kept laying in more and more layers. And it wasn't, the demand on the healthcare back then wasn't what it is today with the amount of medications and pharmacy benefit managers and, where each physician's now literally like you would just go to your GP and your GP would handle your knee problem, your back problem, your stuffy nose, your foot problem. But now we are so subspecialized that you literally have like orthopedic surgeons that only deal with one joint. Like you have orthopedic surgeons that only do hips. That's all they do. You've got spine surgeons that they do the whole spine, but they don't want to touch anything else. And they're orthopedic surgeons originally. And then plastics, and they only do breast reconstructions, or they only do, nose facial reconstruction. So we've gotten so specialized and subspecialized that we've kind of bit our nose to spite our face. But getting back to my original point, and I don't want to beleaguer because I know we only have a lot of time, but so they've kept in layering more and more roadblocks to pathways to care because it became about the profitability in the system. These are for-profit companies, the Blues, Aetna, Cigna, United. And while I take these plans and I'm a provider, my reimbursements have not increased in the last 30 years. If anything, just to kind of put this to bed with everybody, physicians have not had a monetary raise in the COLA, or the cost of living adjustment, that most Americans benefit from since 2001.
I believe that.
And the first thing that gets cut in every budget battle is reimbursement.
The interesting thing about that is, and I can see that in what doctors have to do now, where you could spend half hour with a patient, you got to spend 10, 15 minutes with a patient now, because again, the per patient payback is not there. Now you did something, and I want with my audience, I like to personalize things because again, you know all the numbers, you know all the stats, we both know all those things, but somehow it doesn't reach people as well. But what you did reach people and also help them understand why things must change.
That was not the point of me putting out the post. I was not trying to do that as a viral post.
Doctor,
that was not my intention.
Doctor, let me tell you something, okay? I want to be clear here. It was not your intention, but it was an important piece, because what happens is you were able to relate with that story.
Yeah.
What people are going through and what that guy, just because he lucked out in getting a doctor who was not of the system to see him. Why don't you tell that story? I want you to tell that story, and then I want to interpret that story.
So for your audience and your viewers, so I have been a practicing foot and ankle surgeon, hence the DPM there, since 2002. I've been in practice since 2005, and I've been the owner of my own practice, and I have refused numerous opportunities to sell to capital investment groups and hedge fund managers that want to buy physician practices. I've stayed independent because I remember that the CFO of my old hospital that I'm no longer on staff at, he said to me, Eric, whatever you do, never lose your autonomy. No matter what happens, once you lose your autonomy as a physician, you're
an employee. Right. You're a slave.
And you talk about this all the time, that you're basically a slave to the system once you're an employee. Right? So I do a lot of diabetes. I do a lot of clinical research. I'm one of the experts in the wound healing space, and I've done my share of clinical research with publishing randomized controlled trials. So I have enrolled in another trial for another product for diabetic foot ulcers, and I was able to basically, this gentleman came in, was a chef. He had lost his job. The restaurant closed due to affordability issues. The owner just wanted to just get out. And he had called about 4, I think 5, I think it maybe was 6 clinics. And, the hospitals wouldn't see him because it was too much money, because he doesn't have insurance, right? And so he can't be seen at the hospital. They'll tell him it's $500-$600 just to come in. He called other offices, and given the nature of his problem, and you have to understand, like, to everybody in Egberto land, that when you have diabetes and you have a wound on your foot or an ulcer, it's a metabolic wound. It's not just an open break in the skin. It's a whole issue with your metabolics between the diabetes and your vascular disease and a breakdown of skin and pressure. And it's a whole complicated mess because it's multi-system. So, this is a full workup. It's blood work. I need to know what his hemoglobin A1C is. How controlled has his diabetes been? Is his medication? What's his blood flow into his foot and into his leg? So it's a big workup, and it's a lot of time. It's a big time investment. And especially when they're diabetic, it's like the average diabetic has 1.5 hospitalizations a year on average.
Wow.
And the statistics are there that a patient with a diabetic foot ulcer within 5 years has a 50% chance of losing the extremity. And then once they have one amputation, it's another amputation. And so it's the more people die from peripheral vascular disease and diabetes than breast cancer and colon cancer combined. Wow. But where does all the funding go? Right? Because famous people get breast cancer.
Right.
Really famous people don't talk about their diabetic foot ulcers. Right. So this gentleman, I worked him up. I put him into a pressure relieving diabetic walking boot, did the wound care, debrided the wound, got rid of all the non-viable tissue, got to healthy bleeding tissue, did an antimicrobial dressing, and told him to come back twice a week. And when he asked to how much it would cost, my office manager said, no, nothing. And the story basically was that just the act of me taking care of him, because for me as a wound healer, that's more important to me than taking his money.
Right.
I can donate care. I do well enough. I can donate care to one patient who's really in need and not really, it doesn't affect my bottom line. It doesn't affect me. But what it did was it gave him hope. It gave him that the reaching out of kindness and compassion and extending a hand to say, I'm here to help you. I'm here for you. Like this door's not going to close in your face. And that's what resonated with him.
The importance that why that brought tears to my eyes were the following. Had he not met you, and again, you have to understand this. Meeting you was meeting a needle in a haystack.
Yeah.
He happened to come across you. And in that regards, there's a guy that still has a foot to walk with and a life to live because he found a needle in a haystack.
And go ahead. I'm sorry.
No, please go ahead.
Well, and there's hundreds of us around the country, and
yes.
Like those of us that are truly wound healers, some of us are at academic centers, some of us are in multi-specialty practices, some are individual practices like mine, but we do exist out there. And, whether you live in rural Texas or Southeast Florida or Northwest Michigan, there is a provider there who can help you. I don't know any physician that has the ability to make a command level decision that would really turn away a patient in need. And I think that's
magic. That was magic what you just said. Coming from the CFO of your company who says, never lose your independence. And you independently could choose to help that person without having to worry what the bean counters above you would say. And what I meant about when I said that it was important, that story had so many different degrees of freedom, was that it showed a failed healthcare system, because had he not come across you, he would have lost the foot or be dead.
Or he would be in the hospital and we'd be paying for it.
And all of us would be paying for it. Exactly. And not getting the appropriate care that you were able to provide him because you cared, right?
Yes.
Now, the thing about it is that should not exist in the richest country in the world, a country that has unlimited resources, just disparately going to a few. And you wrote a paper, I don't know if it's recent, but I just came across it with regards to what's wrong with Medicare Advantage. And that can actually be, because Medicare Advantage is private healthcare, it has the same ills of private healthcare, just that most of the money to run it comes from the taxpayer.
Yeah, it does. So Medicare Advantage, when they developed it in 2002, in 2003, the whole idea was to try to ease the burden on seniors and the government. It was to kind of start working their way of government getting out of healthcare. But what we find is that countries that have universal healthcare or have what we call like I don't want to say socialism, but it's a universal healthcare system in a democratic socialist type of setup where excess monies go into the system to help the population.
Right.
It's not about getting rid of capitalism. It's not saying you can't make money and you can't have a business. But if your excesses go to the benefit of the people, which is how the Chinese do things, right?
Right.
And it's how the Norwegians do it, the French, but what happens is when you start taking on more in the system and then the system can't catch up. And you're seeing that in certain European countries. But what we're talking about here with Medicare Advantage is that it was supposed to ease the burden of government. And what we find is that when government is not as involved in healthcare, the healthcare numbers drop. And we're going to see that this year. That data is going to be very evident in 2026 with cuts to the ACA. And what we have to understand too is the burden on physicians. The administrative side is just the amount of paperwork that I have to do. I mean, thank God for like AI scribing and like now the charts being done while I'm in the room with the patient versus me plucking on a computer and clicking and pointing. But like, I think what people need to understand is like AI is not there to replace the physician. AI, we're not there yet, right? It's just language models, but AI is not a replacement. It's a tool. And I think we just need to kind of understand that for the general population, I think they released AI too early. I think it has certain applications in certain aspects of the world and life, but I don't think Gen AI and Grok should be out there for public consumption right now. It's too dangerous. But, getting back to the medical side of things, like my administrative side is like, so I have like 6 hours a day of actual clinical time, but I'm at home doing billing and charting and documentation and follow-up work for like another 2 to 3 hours a day. And that's fairly standard for physicians to have 6 hours of clinical time, but it's really like 9 to 10 hours of work.
Right.
And that's on top of going to the hospital, seeing patients, going to the surgery, doing surgical cases.
Keeping yourself educated.
Right. And then the CME credits too, and which we all have to expend. Like it's on us comes out of my pocket to go to CME meetings. Thankfully, I'm at the point in my career where I'm invited to speak at these meetings. So I get the credits as an educator.
Right.
And I wish I could do CME credits like this. This is an easy 1 hour CME credit for me to do.
There you go.
Right. But with Medicare Advantage, and I want to get back on topic, is that it costs the average Medicare Advantage subscriber. So let's just say you're 68 years old. You've signed over your Medicare benefit to, say, United Healthcare, the Blues, or Aetna, or Cigna. Cigna's out of it now, but okay. It costs 22% more to the U.S. taxpayer for you to be on that Medicare Advantage policy, because what happens is they start chasing after the documentation from your providers for what they call these hierarchical clinical code sets. Mm-hmm. So if I diagnose you with diabetes, if I diagnose you with cardiovascular disease or arterial disease, then Aetna needs to go back to CMS and ask for more money for you as a patient so they can cover your care.
Right.
And they're doing this on the hundreds of tens of thousands of millions of patients that they're signing up. So if you had just stayed on the regular Medicare fee for service, the regular red, white, blue card, and you have a supplement and you do a plan G, plan N, whatever it is you can afford, you're actually saving taxpayer money, and the trust fund would last longer. But what's happening is the typical suck out of the government are private companies, for-profit industry, making billions upon billions of profit on the backs of the American worker.
What is very sad is there is this, we've been led to believe that the private sector is more efficient than government, which is absolutely false. Neither one is more efficient than the other.
Right.
They're just run differently. One is run with a profit motive. One is run not for profit. The thing about it is this: whoever thought that having companies that have to have advertising, that have to pay CEOs, that have to pay shareholder value, and all these things could possibly service Medicare or any kind of healthcare better than government or some single payer system? How does that ever get into the psyche of the American people unless they're simply misled?
Well, it's not a matter of being misled too, but it's also poor legislation, and it's on our elected leaders to make smarter decisions. And I've said this before in other podcasts that we have very unserious people that are representing our interests at the national level. And, we just saw it today. I mean, even yesterday with the Senate Democrats, funded ICE another year.
Yes.
I mean, are you not, how out of touch do you have to be to not watch what's happening in Minneapolis? Right.
Exactly.
I mean, so we have very serious problems, and we have very unserious people making decisions for 350 plus a million plus Americans who aren't serious about what they're doing. I mean, we could have fixed the immigration issue with the Dreamers. We could have fixed gun control. We could have fixed, we could have voting rights. I mean, these are not just blue things too. These are black and white and red, white, and blue things that happen to everyday Americans. Like, yes, the president does not have direct control over grocery costs. Okay. But what he does have control over is how companies are regulated through the FDA, how products are regulated through, in getting to market, bringing innovation to the United States, making things cheaper by bringing in more immigrants to develop more product, to bring industry back into the U.S. without having this, we're going to torch the world down mentality. Okay. We grew as a country and got stronger because of our diversity. We didn't get stronger because we stayed as a whites only club. We became a better country because of our diversity and our, yes, you're from
Panama.
You're from Panama, right?
Yeah. Mm-hmm.
My family came from Romania and Italy. We are all from somewhere else, unless you're Iroquois or Cherokee or Sioux or Seminole or various other Native American. You're not a Native American. You're not.
Right.
You're from somewhere else. Your family came from somewhere else, whether it came by a boat, came by a plane, came unwillingly for 400 years, right? From Africa. It's like this whole notion that this whites only America is such a misnomer. It's such a lie, and we as Americans need to come to grips with our history. Like, I don't think we can ever move forward as a utopian nation. To put this whole experiment together to be this utopia that the founding fathers wanted it to be, we have to reconcile our past.
It's funny that you said that, because I have a new book coming out, and the first chapter of the book discuss that we have to come to grips with our past to move on to the future, because not knowing our past and not knowing our ills and so forth is one of the biggest problems. I also did a documentary called Legalizing Democracy, which actually showed that we didn't start in a good place, but we constantly strive and get to a good place. Or get into a good place.
I look at this like individuals get it. Like as an individual person, you understand that, okay, I might need to go see a therapist. There's things I got to work on. I have to work on my own personal traumas. Like we all get that as individuals, but for some reason, when we get into this group mass mentality, we lose that sight of the fact that the country's broken. Like the systems itself are broken and need rehabilitation. And that this is why you need serious people who are willing to look at the problem and to really try to fix it. Like, it's like looking at yourself. Like it really, I mean, our individualism is a microcosm of the country. Like in order to be a better human being, I need to fix the things I need to work on to be a better person. I need to lose my anger, deal with my traumas in my how my parents treated me or my job or, the traumas that we occur early in life that help decide what we are as older Americans and as we age, dealing with our addictions, dealing with our vices, dealing with our divorces, our children. We all get that individually, but it's almost like the country itself, from a structural standpoint, needs a mental health therapist.
Actually, I think you nailed it right there. But you know what is interesting is there are forces in this country that are the ones that tremendous, because I talk to a lot of people, and I talk to a lot of people on an individual basis, and I don't restrict it to speaking to great guys like you, Doc. In other words, you're a great.
I'm tiny in this little whole thing.
But what I'm trying to say is the following, right? I speak to I'm an engineer by training. Okay, so I look at everything from in sort of a numerical manner, etc. This stuff about individualism and rugged individualism is crap. Never existed ever. But I try to speak to individuals, MAGA and otherwise, and the thing that I've been successful at is getting to the core of people, and in doing so, letting them realize when we are speaking that pretty much, my God, I didn't realize we wanted the same thing. I've done that a whole lot with healthcare, because healthcare is one of my pet peeves. And for every single super capitalist, super MAGA, or whatever they were, whenever we sat down and discussed healthcare, it always converged that this person, no matter where they are on the spectrum, wanted effectively Medicare for all, single payer, universal health, or whatever you want to call it. That is what they wanted, because we could have, what was the word that you used earlier? That we could actually have when there are responsible people running things, or when
serious people
running things, or when you are serious yourself with the things that ails you, you actually come to solutions that solve that problem.
And we used to do that.
Yes. Go ahead.
I kind of remember it's almost like, and I'm not paraphrasing, but I remember that the scene in the series with Jeff Daniels when he was on stage, and the student had asked him, why is it? And that was an epic scene. That was classic Jeff Daniels, right?
Right.
And I don't want to echo, and I don't want to take the thunder from that scene or say that I'm copying off of it, but we are not at the time when they made that, we were 47th in education, and
it was crazy.
Right? And where we were at, we should not be where we're at. And unfortunately, we have a movement in this country that thinks that we need to be poor, uneducated, and controlled.
Yes. Yeah, actually, believe it or not, that is what the tech bros believe. They believe in having a technocratic system, not democracy, where those with technical skills run things. I hate to tell folks something, but if I am on an island, I don't care how smart I think I am, I would love having that farmer with me, because he can turn that island into food. Right?
I'm not a fisherman. I'm not a farmer, but I could probably figure it out. But I mean,
but the thing about it, right, is that the people it seems like the people in our country, I'm not talking about making good money, I'm talking about making an inordinate amount of money, are some of the folks that actually know the least. And I've gone through all our billionaires. Look, I'm not.
That's so poignant, my friend. That is
I have. Let me tell you, this is not just something that I'm saying out of the air. Right. I went ahead and enumerated the billionaires, and then did an actual comparison with myself with folks like you, my sister. And then I said, oh my God, in the scheme of these people's worth to society and what they built with their own hands, intellect, and otherwise, our biggest billionaires are some of the folks that actually have contributed the least and actually know the least. That tells you something about the economic system that we have,
which has been rigged from day one.
From the inception of the country.
It's actually human. It's actually human history.
Right.
All throughout human history, there's always been, warlords and serfs and fiefdoms and kings and servants. And, we've always had this. It's almost like a Ponzi scheme.
Yes,
it's like one big.
Yeah, exactly.
That's one big Ponzi scheme.
Let me show you something here, okay? And our president is the king of them all, right? I mean, think about Congress, and let's think about the Republican Senate. There is a doctor in there that is a very good doctor I think he's from Louisiana. Kennedy, I think is his name.
Cassidy.
Cassidy. And let me tell you, Cassidy is good, no doubt about it. Cassidy is good. But look at what he has allowed the president to get away with in his defense of the president. Okay. And we can enumerate one after the other.
There's about 10 physicians in Congress right now.
Right.
Okay. And don't forget, one of my state senators was the former CEO and chairman of United Health Group, or I'm sorry, HCA, hospital system, Rick Scott, who, what was his claim to fame before he ran for governor of Florida?
He stole money from the Medicaid,
$350 million in fraud, right? So,
right.
I mean, there's a list of things that if I had the ability to do it in one day, it's about 10 things.
Mm-hmm.
I don't want to get into it here because it's very uber political, and I'm trying not to be that way. I'm just trying to be a humanist.
I'm curious. So come on, give me a taste of it.
Well, okay. So my first thing would be, let's just say I win the election, okay, and it's in that transition period.
Right.
The first thing I'm doing is I'm nominating Jack Smith as the Attorney General.
There you go.
And telling him, I want you to have every U.S. attorney in every jurisdiction lined up ready to go on January 21st.
Yes.
Like have the entire DOJ completely revamped before the inauguration.
Right.
Okay. And then because of the Supreme Court basically saying that anything that the president does that is now in official capacity is legal. Okay. You take the gloves off of them and you tell them you go after everybody. You freeze all of the plutocrats' assets. You freeze everybody's assets and you investigate the shit out of them.
There you go.
Okay. You do unto others as you have done unto you, as the Bible says, right?
There you go.
And this is coming from somebody who's Jewish. So, and knowing that, and I actually said it in your chat this morning that because people were talking about the New Testament and the Bible, was that charity is actually the cornerstone of the 6 major religions in the world. It's charity. And when you have people that are spewing Christian nationalism, where's the charity?
There you go. Yeah.
Right. So the other things would be, one is the first rule is to get with the new Congress is to overturn Citizens United. Like you say, if you can get me a bill, I will sign that tomorrow.
Let me tell you, Doc, I've been working with Move to Amend and several others on the 28th Amendment. And it actually has 2 things. It would get rid of Citizens United by saying corporations are not people and money is not speech.
Right.
Corporations are not people and money is not speech. We have several sponsors on that bill, but getting it through has been difficult.
Because it's against their own self-interest.
Yes.
Term limits for across the board, all federal positions, term limits. If it's good enough for the president and the vice presidency, okay, it's good enough for the Senate. It's good enough for the Supreme Court. It's good enough for federal, for district court, appellate court, Senate. Doesn't matter. We even have term limits for like FBI and CIA directors, right? I mean, like they serve a 10-year term. And why is that? It's so that they're supposed to be nonpartisan. I mean, if it was up to me, I think you pull the Chief Justice in on day one as well. And you start saying, listen, we're going to start investigating for bribery. And so I expect these
Clarence Thomas,
these justices in sequential order will be resigning or they're going to face charges. I just think you have to clean house. We have to fix the systems. And then you've got to work with the Congress that we need almost I think Nick Perro said this, that we need a constitutional reformation. We don't need to rip up the Constitution, but we need to reform it and bring it up to modern day 2026 and plug the gaps that this is all exposed, all these gaps in the law, gaps in the Constitution, and do the best we can to basically repair the dam.
Yeah, because the truth of the matter is Donald Trump proved how ineffective much of it is, right?
Well, I don't think the founding fathers
Expected a Donald Trump.
No, they actually expected Donald Trump. What they didn't expect was an obsequious Congress.
Oh, I see what you're saying. In other words, that the reason you have the checks and balances is that if Donald Trump came, you had two other to keep him in check.
And maybe you can explain this to me, because I can't wrap my head around this concept. Mm-hmm. You spend your entire career as a public servant, politician, state level, work your way up. You get elected to Congress, right? You have a seat at the big table. You're one of 535 legislators that represent the United States. You have a big chip in the game, right? Why would you give your power away? Like, you could be a hero. You really can be a hero.
You just said maybe you can explain it. The truth of the matter is I can't. Yesterday I went to a rally. You saw the show this morning. And I have so much love for these women because they are doing something, but the men are sitting back with the tails between.
They're sick. The manosphere of this country is sick.
Yes, and when I say it's a male thing, I am not being. I actually, it is as if the male doesn't want to go against the leading male. I don't get it. Just like you said, I don't get it, and that's why I so revere these women, because sometimes they come to me and like, Egberto, you think we're doing this right? I'm like, my dear, you guys are the only ones doing something.
Even there was another post where they were protesting Target, right? It was all women in line. They had all bought salt to melt the ice. Like, that was like the whole thing. They all bought kosher salt, and then they returned it, right? They were trying to make a statement, but it was all women in line.
Yeah.
And listen, women are 53% of the electorate.
You said I did see that comment that you made in the chat this morning. Yeah.
And unfortunately, it's women that are going to have to save us from ourselves. Because,
yes, I think so. There's something about the male, and I think I don't think it's a genetic thing. I think it's just a cultural thing with males, and it's not just here in the United States. It's all over. And I think women, I see the women in the United States starting to act out on it. But I want to kind of get us back into the healthcare picture here, because first of all, are you a proponent of whatever you want to call it, Medicare for all, single payer, universal healthcare?
So, being in the system that I am, I mean, as much as I'm a cog in the system, okay, I've been on Capitol Hill. I've been in those stakeholder meetings. I've testified at Bethesda. It comes down to the people that are running the agencies.
Right.
And like, they just don't listen. They just, like, in my particular field of work, we have a coverage policy regarding treatment of diabetic foot ulcers and venous leg ulcers.
Right.
This has been a problem since 2015, where whether it was the payment, I'm not sure if you saw the stories in the New York Times about the profiteering with the tissue products, and the New York Times kind of blew this up at the end of last year, where in 2022, the Medicare spend on these tissue products was like $1.2 billion. By the end of 2024, it had ballooned to $13.2 billion.
Wow.
Okay. And the reason for that was, for example, if you are your company and you have a product on a sheet that looks like this, right? Okay. And this is being reimbursed at $1,500 a square centimeter,
right?
Which is like normal, right? And then you have another, and you realize that you can make another product that's exactly the same thing. Okay. Same thickness, everything, right? But you can rebill it to Medicare with a new code, with a new product code, and get them to pay $3,800 for it.
Okay.
Okay. And we in the industry were like, what are you people doing? Like, it's this, like, you're just like, they never, like, for typical drugs and biologicals, the rule of thumb is they do average sales price plus 6%.
Right.
Okay. So if a drug costs $20,000, we're going to reimburse the physician $20,000 plus 6%. If you had like an infusion of Tresiba, for example,
right,
at your dermatology office, their doctor's paying invoice cost plus, and you would get 6% back on the Medicare claim.
Right.
That's basically your tax profit, right?
Right.
Okay. But that's not what's happening now. So now what Medicare was doing is they were just approving all of these products at sky high reimbursements and because it's CMS and it's the contractor. So what people don't understand is there are 5 companies that manage Medicare around the country on the Part B side, on the outpatient side.
Right.
So you have really, in essence, a privatized management healthcare system with Medicare. It's all government money, but they're private companies that administer the Medicare system, right? So one company is GuideWell Health, and they're based in Dallas, Texas, and they have Texas, Oklahoma, Florida,
Right.
Puerto Rico, Virgin Islands, Pennsylvania, New Jersey, Delaware, and DC. Okay, so they administer 15 states. Then you have Noridian, which is out west, mostly the western U.S. Then you have Cigna Government Services, which is like Ohio, Kentucky, West Virginia. And then you have National Government Services, which is the Northeast.
Right.
And then you have Wisconsin Physician Service, which is basically Michigan, Indiana, Wisconsin.
Right.
Okay, so you have these 5 companies that administer Medicare around the country, all who have had different coverage policies and different criteria. So imagine this, and I get this living in Southeast Florida. So I have a patient of mine who lives in New Jersey, works in New York,
Right.
and has a winter home in Florida.
3 jurisdictions.
There's 3 separate jurisdictions with 3 separate coverage policies.
Right. Wow.
Okay. So, and all that a local coverage policy says is based on the evidence. This is the recommendation by the work groups, by the evidence presented in the literature, the clinical research. This is the standard way we're going to treat this, that we want this problem treated. It's no different for like cardiac arrhythmia, knee replacement. It's a coverage policy, right?
Right.
And this is the guidelines by which the societies have said this is how we treat it. Okay, fine. So you've had private investment companies that have been pushing Mar-a-Lago for the last 2 years to wipe out the coverage policies, to extend the delay of the institution of these policies, which resulted in more profiteering last year.
Mm-hmm.
Okay. There was an executive order in April of last year that halted these policies from going into effect. And then as of Christmas Eve, coincidentally, at Mar-a-Lago, another executive order wipes out the coverage policies.
Wow. Wow.
Okay. So now Guidewell Health, which is First Coast Service Options and Novitas, and I think CGS are the only jurisdictions in the country that have a published policy to cover patients for diabetic foot ulcers and venous leg ulcers. I mean, that policy is dating back to 2018. So because they rescinded the policy under the Administrative Services Act, they have to scratch everything. They have to start all over again, write a whole new policy, open the whole thing up for public comment again, which could take another year.
Right. And what happens in between?
They go by the original policy. But if you're a physician in a state, say like Oregon, okay, then your documentation now has to show significant medical necessity for the using that product. And then on top of it, they put the WISER project in. So here's a new thing for
the WISER is crazy. Yeah.
The WISER project, for people that don't know what this is, these are 5 companies in Washington and Arizona.
Texas is also
Texas,
in there.
Oklahoma, and I think Ohio and New Jersey.
Yeah.
Okay. Where they're doing AI-based pre-authorizations for certain clinical procedures. So it's just like a government program using AI.
Private sector AI. Yeah.
Private sector AI, collecting data on people. Okay.
Yes.
To do clinical medical reviews that are not going to be evaluated by a peer for prior authorization. So you could be going for a knee replacement, but because the AI says that the clinical record that the physician did not qualify your knee replacement, we're not going to cover it now. So now the hospital, this is going to be a whole nother.
Now, the interesting thing again, Doc, is the following. You shouldn't have 5 different companies managing this because it creates unnecessary.
It's okay, but if they do it the same way, it's fine.
But my thing is, why have I get that. My problem with all these issues, right, is I want private doctors like you are and others. I don't want corporate doctors. I want private doctors. Okay, that's number one. But where we need mass influx of monies, like what those 5 units are doing, I want what makes that more efficient than having a government agency that does that for the entire country with one.
Most of the system's automated. So when we submit our claims electronically, like 98.5% of the claims are pretty much paid out and adjudicated properly.
So
but what happens is if they start seeing patterns,
right,
they'll go back and do a clawback audit.
Right. I get that.
Years after the fact, after that money, that physician has already spent the money, done with it. Yeah. Now they do clawbacks against future reimbursements. So the catch-up system's not good, but there is no perfect healthcare system, right?
True.
There isn't any. And that's why you see more and more physicians going concierge or direct payment, like a direct pay model.
Right. Right.
Okay. And you're going to see over the course of the next year or so, less and less physician groups independents taking insurance because of the loss of coverage and the lack of reimbursement. It's not worth my time to, for example, see a Humana patient. I don't get paid enough.
Are you a concierge doctor with your service?
No.
Or
No.
You do take insurance?
I do take insurance, but I have a lot of services that are not covered by insurances, which are cash services because they're electrical medicine, regenerative type, like platelet-rich plasma, or orthobiologics for osteoarthritis, things that are not generally covered by insurances because of the work that I do.
Now, you see, you make a good template. Let me tell you, I'm glad you told me that. You make a perfect template, right? You take insurance for the things that are classified within policy. Excellent. There are other services that you provide as a privateer that people, if people think it's beneficial for them, they're willing to pay you as a doctor to do these things. So the model is perfect. The thing that I find wrong, and to put it bluntly, sort of immoral, is the insurance companies proper. Everything that Humana and Cigna and all of them can do, a single payer system would do for less. And you've already told me right here in this discussion, most of the stuff is automated and there are clawbacks for wherever fraud is detected, or not necessarily fraud, but whenever things were coded wrong, etc. Again, the problem in our system right now, the first tier problem is, yes, the insurance companies. You also brought out a second problem, and that is for those people who use the things like, well, newer medications we pay more for newer medications than older medications. We need to find a solution to it. But those things are solvable on a national level once they're detected.
Right. So in the Senate Finance Committee that just passed through the HHS appropriations bill, and I put this out last night, what they did do is they did what's called a pharmacy benefit manager reprieve, where they basically uncoupled the Medicare and Medicare payment tied to the pharmacy benefit. It's now uncoupled. So now they can't tie that directly to Medicare, Medicaid payments. So it's a whole separate. So they basically uncoupled all that, which is, thank God, finally. It's only taken 25 years because that was the Medicare Part D that President George W. Bush put through.
Right.
But that was the big credit card, with the Iraq War. Those were the three things. It was the Iraq War, the Afghanistan War, and then the Medicare Part D, which was never funded, never paid for.
Right.
And then what happened is when the Tea Party came in 2012 and took over the Congress, they passed the sequester.
Right. And it's still in now. In fact, it's in right now for this bill that the president passed.
It's still there, by the way. So this sequester, this 2% clawback that every physician, every provider, healthcare that bills Medicare Part B eats, we lose 2%. So, all right. So keep this in mind. So let's just say an office visit's $100. Let's just say this is the Medicare fee schedule. They're going to reimburse $100 for an office visit. Automatically, that reimbursement's cut 20% because Medicare will pay 80% of the approved charge. Right. So now I'm at 80. Okay. But it's not 80 minus the 2% sequester. So now I'm down to 78.40.
Right.
Okay. Let's just assume the patient doesn't have a Medicare secondary. Let's just say it's Medicare, Medicaid. So Medicaid never pays that coinsurance.
Right.
So that $20 is gone. I'm never going to see that $20, right? So out of that $78, I need to cover my office costs, my rent, payroll, supplies, malpractice insurance, electric, water, biohazard waste, radiological waste, all the things that are involved in running a medical business, right? And then whatever's left over is my salary, which might be $5.
Right.
Out of running the practice. So there's all these administrative costs that we have. And it's not like I don't get to submit claims for free. I pay a clearinghouse per month to, for my claims. I pay my electronic health record service, for storage of all the records.
It's a lot.
It is a lot, right? So when patients go to see physicians, just remember that whether they're a management group that owns the physician group with a hospital, or it's a separate independent group, it's like any other business. You have your costs associated, but what physicians are really bad at, Egberto, they don't know their acquisition cost. Don't know how much their acquisition cost is per patient.
Right.
They don't know their cost of goods. Right.
Yes.
Like most businesses, what your cost of goods are. You develop a software product. What it costs you to build that software program. Right.
But if you're bringing a new customer into your fold, you don't know anything. In fact, that bringing a new customer could actually cost you more in certain instances.
It could, but we do have different billing levels for the various complexity of the service.
Right.
But think about this. So if I have a new patient, right? My average new patient time spending with them is about 14 minutes.
Right.
And that's clocked on my AI scribe, right? So in that 14 minutes, I need to find out why you're here, your medical history, and I have to process all this information in order to come up with a clinical decision making.
Right.
So what's not being paid for is up here.
Right.
Is the what we call the
it's the intellect. I mean, it's
the intellectual property that I own.
Yeah, absolutely.
That's not what is being reimbursed. When Medicare looks at a service, they look at what's the work unit, like here's the average work unit, here's how much there's a Medicare conversion factor that they cross that with, and they look at the practice expense, the malpractice expense, the wage area that you're in calculating, your wage expense kind of thing. Oh, that was the other thing too with this, with cutting all the money in the skin substitute stuff. What they did was they made a flat payment this year of $127.28 per square centimeter. Okay. So for every 2 inches of a product, they're going to reimburse $127, but it's not because they tied it to the wage index. So think about if you're practicing in San Francisco, right, where the cost of living is significantly higher, that wage index is like, say, 1.69. Okay. And you can search this stuff. It's on the PGC website, whatever. But imagine a rural provider in Louisiana where the wage index is 0.86. Yeah, lower than 1. Yeah. Okay. So now you're looking at 127 times the wage index. So that versus, say, like San Francisco, like for me in Fort Lauderdale, it's 1.08. So I'm getting like 132. Right. So my friends who practice in Louisiana are getting only $88, while I'm getting 132. But here's the thing. They're paying the same price for the same product that I'm paying. Exactly. Which makes absolutely And this is why it's so important that we fund rural healthcare. Look, that is what, let me just put it bluntly. That is why the truth of the matter is we have to get rid of it. And I don't know where you stand on this. We need to get rid of private health insurance. We need to keep private doctors because, again, I went through your template of insurance and what you do as other type of products. We need the private sector doctor, like we said, would be in the first place, and all the things that don't require intellect should be socialized. Everything that doesn't require intellect, nobody questions the cost of the fire engine when you call 911. Exactly. They don't care. They just want to know when you call 911, fire department shows up, or the police, right? Or when you flush the toilet that it goes somewhere else. Down. Right. Look, that is the thing that I think discussions like this can show and what you do. I'm glad that, when you have a doctor that can speak on these issues that are not only related to doctoring, I think it opens certain types of doors. When you have engineers speaking about certain types of politics, it opens certain types of doors. I think it is so important to have all these concepts. Now, we are running close on time, running, but the good thing about it is that we had an encompassing discussion that makes a complete show. So you actually are going to be a complete show on the Pacific my friend. Thank you so much. And I really appreciate this. So I'm going to ask you to give me a closing statement. And then we'll move on from there. Well, I just wanted to say thank you so much for having me on your show. And I think this was such a robust conversation that we covered a lot of stuff. And I just want everybody to understand that you have a voice. You have the will to make decisions for your own healthcare. Like, you are your own best advocate, and just become more educated. Keep reading, keep understanding what you're doing and your choices. You always have a choice. And remember, our lives are based on our choices that have good outcomes and our choices that have really bad consequences. So let's all try to minimize our bad consequence choices as we move through the rest of the year. And God bless everybody. Alberto, thank you so much for what you do. You're such a staple in the independent media world, and I'm really glad that we were able to connect and do this. So thank you, my friend. Well, Dr. Eric Lullub, let me tell you, I will have you not another time, but many other times, because you have a body of knowledge that I think we have to get out there. And having someone like you doing this is very important in what we do here. So thank you so kindly. Folks, that's been Dr. Eric Lullub, who is the Chief Medical Officer of the West Boca Center for Wound Healing in Coconut Creek, Florida. Thank you so kindly for having been on Politics Done Right. Thank you, Alberto. Everybody have a great day. Thank you.
I want to talk now a little bit about what occurred on today. I'm going to start with what Representative Swalwell had to say. Swalwell made my day the way he slammed his Republican representative brothers and sisters, because he told the truth that I imagine some of them were saying, okay, it's okay for you to say that, Swalwell. Please don't call my name, because I know I've told you this, but please don't call my name, Swalwell. Check this out. This is what Swalwell had to say when he had his turn at the hearing today. I think you're going to find it quite amusing.
Everything right. Harry Dunn, Danny Hodges, Sergeant Cannell, Mike Fanone, they did everything right. These guys, my Republican colleagues, are a joke. They're wrong. History will harshly judge them. So I want you to lean in today. You have nothing to be ashamed of. You did everything right, sir. And these guys are so lucky they're not under oath, because they would have to tell you what they really think of Trump. They call him crooked. They call him cruel. They call him a scumbag. I've heard you all say it. You're lucky you're not under Trump, but when the lights go on and the cameras are on, you're tiny, you're small, you shrink. Everyone remembers Matt Gaetz coming over here after a committee hearing. He would laugh at how stupid he thought Trump was. This is all a show. And Mr. Smith, you're just the latest act that they've brought in. But they can't erase what happened on January 6th, because we saw it with our own eyes. Mr. Smith, after the mainstream media called the race for Biden about a week after the election, did Donald Trump concede the election?
He did not.
The next month, the Electoral College met in every state and voted Biden as the winner. Did Donald Trump concede then?
He did not.
Shortly after that, the last court case that Donald Trump brought was thrown out. Did he concede then?
No.
Is it your judgment then that only Donald Trump could have convened the mob in the size that it was assembled on January 6th?
Our assessment of the evidence is that he is the person most responsible for what happened on January 6th. He caused what happened. It was foreseeable to him. And then when it happened, he tried to exploit it in furtherance of the conspiracy.
And you actually obtained indictments from a grand jury, right? You went to a grand jury and did something that the Trump administration has not been able to do, as they go after their enemies. Their cases are being thrown out. You obtained criminal indictments against the president. Is that right?
That's correct.
Mr. Smith, do you know who Edward Loya is?
I'm sorry?
Edward Loya, L-O-Y-A?
I believe Mr. Loya worked at the public integrity section when I was.
Did you know that he said of you, when it comes to investigating allegations of sophisticated federal criminal matters, Jack Smith is the gold standard? Do you know who Mr. James McGovern is?
Yes, he was a prosecutor I worked with in New York.
Did you know that he said of you, I have no idea what Mr. Smith's political beliefs are because he's completely apolitical? So are you a registered independent?
I have no partisan loyalties. I don't know if I'm registered as independent or not registered at all.
Are you glad you accepted Attorney General Garland's request to be a special prosecutor, even though you've been dragged over political barbed wire and your family has been subjected to death threats?
I don't regret it.
Do you remember where you were on September 11th?
I do.
What did you think of that day?
I was in Brooklyn when that happened. I was at the command center that night. I worked on that investigation. I remember pretty clearly.
Do you remember where you were on January 6th?
On January 6th, I was living in Europe working for the State Department, seconded to a war crimes tribunal.
What did you think as you watched on television what happened at the Capitol that day?
To be honest with you, I don't recall if I saw it that day or a later day because of the time period.
What did you think when you saw it?
I was shocked. I was shocked by it. I obviously, being in Europe and not following things as closely, I was not, frankly, up to speed on the events leading up to it.
What shocked you about it?
I I just never seen anything like that happen in our country.
Mr. Smith, I don't know if I'll ever have the honor to talk to you again. If I don't, please know that I and my colleagues on the Democratic side, and even my Republican colleagues when they speak privately, have nothing but respect and appreciation for what you tried to do and how you did it.
Absolutely. So I'm so glad he expressed himself the way he did. But in as much as he asked important and pertinent questions to Jack Smith, what I love is that he pointed out to his Republican brothers and sisters, hey, don't forget, you guys have always come over here and talk about how dumb you think Donald Trump is or how stupid Donald Trump is. And then when the cameras are on, you get tiny, you get very small. You can no longer tell the truth. But none of you have any respect for Donald Trump. You just fear him and you act it out. You fear Donald Trump and you should be ashamed for how fearful you are. You know, it is funny because that is how it is with most people. Most people don't like Donald Trump, and he knows it. You know, Eric asks, why don't I show some of the other side? This is a truthful program. We don't show fantasy on this show. So there's nothing I'll play from Republicans who came out here on that thing because nothing that they were talking was real. Why the hell will I add more to the unreality? Why the hell would I add BS to the airwaves? I won't. So you will never see that crap on my channel. Ever. Because they're liars. I don't put liars on. Well, I put liars if I need to make a point. If I need to make a point, I'll put the liars on.
All of our country's problems, from polarization to ignorance on domestic and international issues to a complete misunderstanding of our economic and healthcare systems, are a direct result of a derelict mainstream media that too often bend over backwards to support corporate or bought politicians' wants as opposed to the people's needs for real information to make their lives better. Independent media is the only solution to inform truthfully and factually. Why? Because our loyalties are to you, the ones who fund us with small dollar contributions and subscriptions. It's an investment that pays incalculable dividends.
Support for this show, Politics Done Right, comes from politicsdoneright.com, publishers of How to Make America Utopia, Take Away the Economy from Those Who Rigged It. As I See It, Class Warfare, The Only Resort to Right-Wing Doom. It's Worth It, How to Talk to Your Right-Wing Relatives, Friends, and Neighbors, and other books written by Egberto Willis.
Welcome to Politics Done Right. I am your host, Egberto Willis. This is a progressive program that will take the mystery out of politics. This is the program that will encourage you to make sure government becomes we the people. Whether you are liberal, progressive, conservative, or otherwise, you get to air your point of view. We are an independent media outlet that, unlike mainstream media beholden to corporations, we only owe allegiance to you. Remember, you can also send me a tweet at EGBERTOWILLIES. That is at Egberto Willis. Let us engage. It is Politics Done Right.
Support for this show, Politics Done Right, comes from politicsdoneright.com, publishers of How to Make America Utopia, Take Away the Economy from Those Who Rigged It. As I See It, Class Warfare, The Only